In today's operating room environment, hospitals and surgeons are being asked to do more with less, while being pushed to deliver the very best patient outcomes possible. Both need help. Surgical assistants provide a cost-effective solution to these ever-increasing demands. The medical community at large has agreed that the value received and the results obtained are increased when surgical assistants are present on surgical teams. In fact, legislators from the local through federal levels of government are becoming increasingly aware of the benefits that surgical assistants provide to healthcare. We recently traveled the country to interview some of the leading healthcare experts to ask them why they feel surgical assistants are such a critical part of their surgical success.
Surgery is a team sport, and you don't do it alone. So in my opinion, a surgical assistant is an invaluable team member.
Our surgeons, frankly, will not work without them. They are that important to the surgeons. If I have a surgeon that is getting ready to do surgery and I don't have a surgical assistant, they will not start.
The surgeon and the surgical assistant become their own team.
I often talk about them as being the right hand or one of the right hands for the surgeon in the ORs.
The first assistant role is to be an integral part of the procedure itself.
They're not physicians, but they have training and skills that allow them to work in the operative room and to assist the surgeon in performing procedures.
In the OR team, we have many different positions. Obviously, there's somebody up at the head giving anesthesia. We have a nurse, we have a surgical tech who hands instruments, and we have a surgical assistant who is directly in the field involved. However, I believe the surgical assistant does a little bit of everyone else's job.
A lot of what we do is make sure that the surgeon has what they need when they need it.
We start out before the case begins, helping getting everything ready, working with the rest of the staff.
So when the surgeon is done talking to the family, then they come to the operating room, they have confidence that the surgical assistant has already brought the patient in the room, verified the surgical procedure, made sure all the site marking and the paperwork is done, that patient is correctly positioned, all the equipment has been tested, checked, ready to go, so that when that surgeon scrubs in and walks into the operating room and ready to start making that incision for the procedure, all those boxes are checked off.
And then we're there for the whole procedure to assist the surgeon to make sure everything goes smoothly.
One of the things that the assistant gets to do is know how you perform the surgery, what exactly you expect from them. They anticipate your every move, and they're there with the instrument when you need it.
As a common example, during a lumbar surgery, we have to expose the spinal cord and nerves. My assistant is there protecting the nerve while I take care of the disc problem or whichever condition we are treating. So they're integral, their assistance is invaluable to me.
More frequently nowadays, I do laparoscopic surgery that's robotic assisted. So the assistant is the only one who is standing next to the patient at the table side. I am at a console that is approximately 10 feet away, and I rely a great deal when I'm doing robotic surgery, I rely a great deal on that assistant to be my eyes and ears and sometimes hands.
They also are trained in, imaging, what images they have to put up on the screen for the surgeons during the cases. They are trained in what equipment that is needed, how to set that up, how to troubleshoot. Oftentimes patients are in surgery for numerous hours, and you can only imagine that their skin and their bones and muscles are in one place for all of that time. So it's very important that those patients are positioned correctly so they do not have any damage to any of those areas. So that is a major role of the surgical assistant.
At the end, we're there to close the patient up, to put the dressings on, move the patient back to the stretcher so that they then can go to the recovery room.
Surgical assistants can work with any of our surgeon specialties, and I think we have examples of those across all of our practicing surgeons: general, orthopedic, neurosurgery, cardiovascular,
GYN, Da Vinci, robotic surgery.
I love being a surgical assistant. I can't see myself doing anything else. Every single day is a challenge. Every body is different. It's an exciting field to be in.
So the surgical assistant is there to help provide safety for the patient. There are numerous lawsuits across America, the world, etc. A surgical assistant can be a second pair of eyes.
Sometimes the surgeon becomes so enthralled and so concentrated in what they're doing at the surgical field that they need a second set of eyes to alert them to the fact that there might be some bleeding going on, and they want to point that out to the surgeon so the surgeon can shift their attention to what they've been concentrating in to something that might be of critical importance that they have not been paying attention to.
Instead of having two surgeons to do a procedure, I'm trained to take that position. I have the knowledge and the training behind me to be able to have my hands in the field and help them.
They provide sterility. Surgical site infections can last for years if a patient were to have one, so it's very important that the area maintains sterility.
We decrease the anesthesia time and increase the efficiency of the process, which of course leads to better patient outcomes.
There are some surgeons who may do surgery without an assistant. They may do it, say, with nursing staff. Not to discredit nursing staff or anything of that sort. However, the additional training, the additional expertise, I would encourage surgeons to consider adding surgical assistants to their practice.
There's faster turnover, so we can get more surgeries done in a day than we could if we couldn't do without a surgical assistant.
As physicians have had medicine change around them, the implementation of electronic health records and other things that now take their time, I think part of the frustration is I want to be taking care of patients, I want to be operating on patients. The addition of surgical assistants has really helped them to do that.
Next door, we're preparing a surgery. As we're talking right now, a room is being prepared, a patient is being wheeled into the room, a patient is being positioned in my practice, which without a surgical assist, I would not have the luxury of time to do this. So going back to that point of allowing you to be in two places literally at the same time, and or an extension of yourself into another room.
If we didn't have surgical assistants, we would be back to where we were decades ago, which is needing additional surgeons in to assist other surgeons in performing operative procedures.
My life would be a mess. If I didn't have a surgical assistant, my surgical performance would be diminished.
In the US, there is a required certification. There is a vetting process to go through surgical assistant training, then in similar fashion to medicine, to go through clinical rotations.
Education and training for a surgical assistant is very specific for what we have them do for the role. It's a technical role, so they get a lot of technical training.
One of the largest things that I think has benefit that the surgical assistant studies and other professions don't typically is gross anatomy. And understanding tissue planes, understanding the surgical anatomy is way different than the basic anatomy, which shows where it originates, where it inserts, and what it does.
They've got to know an ankle, they've got to know an ear, they've got to know face, they've got to know finger. So you can only imagine the amount of training that it takes to learn all that, and the amount of studying and time.
I would say that surgical assistants have been around since surgery began. Maybe we just didn't call ourselves surgical assistants. There's always been a second set of hands to help in surgery, but it hasn't always been a specialized field.
It was in the late 1970s and 1980s or so it really became a professional designation. Surgeons started to notice that you needed some specialized training to kind of function in that role.
I think over time it's been something that was initially viewed with some skepticism to now they're fully embraced.
I'm also an employer of surgical assistants, and I hired 6 surgical assistants in the last 2 months, and I could hire 3 more. So the demand is there.
Every hospital in this area has a need for surgical assistants.
I'd like to see the younger generation go down the road of becoming surgical assistants. It's important, it's a job that will always be there. It's important to the healthcare of our nation.
Healthcare industry is changing at remarkable speeds, and so is the need for allied health professions. And surgical assistants are growing in leaps and bounds.
I see this position as having an integral part of providing health care in the future for a very, very long period of time.
I think if the public and the government agencies knew what the surgical assistant did in an operating room, I think if it were more widely spread, they would understand why it's so important to have the surgical assistant in the operating room.
Surgery is not always a happy place. There's not always a happy outcome, but knowing that I've been there to do the best that I possibly can do for the patient, and that I've been there to help the surgeon to make his job easier, that gives me satisfaction every day.
When it comes to efficiently creating clinical and financial successful surgical outcomes, surgical assistants can and need to be part of the equation. Many of the nation's leading hospitals and surgeons consider surgical assistants an invaluable part of their team, and you should too.